For me, these delusions really showed up when I got back from Africa. That would be fall of 2003. And I spent a period of about 3 years homeless, living here and there, sneaking into a university campus, sleeping in libraries, sleeping in abandoned dormitories. And during those 3 years, I think that if I had seen a psychiatrist, I've been forced to see a psychiatrist, I very well would not have been diagnosed. I could have explained away taking time off. When I had ideas that I was going to
You were able to pull it together.
I was able to pull it together, and I knew that if I told someone I wanted to be like Mother Teresa or I was becoming like Bill Gates, I knew that that would sound crazy. So I always kept it to myself for this period of 3 years. The thing was, after about 3 years, one day, January 28th of 2006, I still remember, this is when my hallucinations started. That was the day when I began hearing voices. After I'd heard voices probably for only a few days or a few weeks, as they got worse and worse every day, this is when the psychiatrist would have diagnosed me with psychotic illness. Because the hallucinations, I kind of crossed a line when they showed up.
Yeah, that would have been a much clearer sign. Hearing voices is typically something that's not normal. Now, there are a couple of times when hearing voices is normal.
Really?
So it's possible when you're falling asleep or waking up to have hypnopompic or hypnagogic hallucinations. So hypnagogic, I think of gogic as groggy, is hallucinations when you're falling asleep, and hypnopompic is hallucinations when you're waking up. And most people, if you ask them, when you were waking up or falling asleep, have you ever heard someone calling your voice or thought you heard somebody talking to you? Okay. And then you wake up all the way and there's nobody there. That's not a symptom that we get worried about.
Okay.
When you're fully awake, hearing a voice or a running commentary or noises or sounds or a mumbling, sometimes early on in the illness, there's not distinct, discrete voices where you can hear what they're saying. Okay. There may be a low mumbling sound.
Interesting.
That's sort of how we think about the auditory hallucinations that are associated with schizophrenia. Now,
they're different. They're worse.
They're different, right. Now, the other thing is, though, you can have psychosis and hallucinations in other disorders.
Okay.
So withdrawing from substances or some substance intoxications, some drugs that are drugs of abuse, if you use them, they can cause hallucinations.
Okay.
People with depression, people who have postpartum depression can have psychosis. People with bipolar disorder can have psychosis. So it doesn't mean you have schizophrenia if you're hearing voices.
Okay.
It means we have to think about whether or not you have schizophrenia.
Very interesting. So my two categories of symptoms that I struggled with most were delusions and hallucinations, really in that order, 3 years of delusions followed by hallucinations. And the hallucinations started to influence my behavior. When they really got bad, I was screaming back at the voices, living outside. For me, I haven't had as many cognitive symptoms, and I also haven't had as many of the negative symptoms of schizophrenia. What do those look like?
So the negative symptoms can look like sort of a flat affect, a face that, facial expressions that aren't sort of interactive and changing like we normally see. The other thing we can see is more of a monotone voice. Okay. There's a fancy word for this, it's prosody. The prosody of the speech, of your speech, is the melody of your speech, and there's inflections in it, goes up and down, depending on how you're making your points. There can be deficits in prosody, deficits in facial expression, deficits in how you interact with other persons. Often when I'm interviewing a patient with chronic schizophrenia that has profound negative symptoms, I might ask them the following line of questions. So what do you do all day? I watch a lot of TV is what they might say. And I might say, well, what TV show do you watch? And they might say, I'm not really sure. I always have it on channel 42. Think about that for a second. If you ask anybody in the world what their favorite TV show or Netflix show is, or whatever the young people do, they can tell you right away.
Downton Abbey.
Downton Abbey, Sopranos, Breaking Bad, whatever. You're going to get a quick answer.
Yes.
So patients who have schizophrenia, who have these negative sort of things that are missing, are missing some of that stuff that the rest of us have.
Okay.
This sort of what we call neuroplastic deficits,
Or
the ability,
involvement, really.
the ability of the brain to sort of have the richness and the executive functioning is really something that can be missing.
What I found is interesting too about schizophrenia is there's so many types of schizophrenia, such as paranoid schizophrenia, catatonic schizophrenia, I believe, disorganized schizophrenia. Everybody who has schizophrenia has a different presentation of symptoms. So there may be a person out there with a lot of negative symptoms who has a very different experience than my experience having mostly positive symptoms.
So this is a really challenging area to sort of conceptualize. A number of years ago, if you had negative symptoms and cognitive symptoms only, without the positive symptoms, they called that simple schizophrenia.
Okay.
What we know now is that the subtypes of schizophrenia that are in the DSM, the sort of the diagnosis manual for psychiatry,
Okay.
don't really hold up when you look at the genetics. When you do the genetics of patients with schizophrenia, they don't divide into the disorganized, catatonic, paranoid, undifferentiated. They don't divide up into those pods.
Complicated.
So, it's really hard to conceptualize.